Go ahead.
Wonderful. Thank you, Mindy. Good morning, everyone. I am so happy to have you here today. My colleague Natalie Jones and I have been super excited about this session because it's so personally relevant. And as I was chatting with Mindy before this started, her podcast, I think was recorded almost 4 years ago. She said it was one of their first episode or information release was 4 years ago. And this was one of their first podcasts. But it just shows how timeless this topic is. Natalie, what would you like to say about this?
Yeah, so I think that there's a lot of news going around all of us, especially right now. And so as you guys watch the news, as you read the news, as we mentioned in the podcast, like friends are sharing news of interesting or important things, whether it be over the phone or through social media. We want to make sure that you guys are able to sort the fact from fiction, and that you know that the news or the information that you are consuming is quality information. So we are going to help you find out how you can sort fact and fiction, and then maybe some go-to resources and places where you know that there's trusted information out there. So that is really what we're going to help you do, sort through the noise so that you can find the news and the correct information.
Great. And we are going to be just like two gals chatting online with you today. So we're going to go back and forth a lot. But first, we want to hear from you. So if you're on your phone, or maybe you're on your computer and you have your phone or another screen, I want you to go to menti.com. That's M like Mark, E like Eskimo, N like Nancy, T like Tom, I.com. And you will use the code 826756. And don't worry, I'm going to change screens, but don't worry. You will get that same information for you right here. And we just want to ask you two questions. All right, we had one person respond already. Our first question for you today is, in the last month, have you seen or heard something that left you wondering whether it was true or false? And just so you all know, these responses are anonymous. We don't know who is answering what, so your answers are secret with us. And just a reminder, we want you to go to menti.com, and that code is 826756. And I love this little donut because it activates. So far, it's one color. I know we had 3 answer options. I'm not sure if we'll get all 3 of those today. Looks like so far 27, about 30 of you have said yes. Just in the last month, I've seen or heard something that left me wondering whether it was true or false. And we thought that this would be a pretty relevant topic. And so I think seeing your responses right here confirms that, yes, that is true. All right, we got one, I'm not sure. There we go. And that's something we're going to dive into in this session, is that sometimes it's hard to tell, and maybe we share information because we're not sure whether it's true or false. And we might want to hear from others what they have to say about it. All right, that pink color that just popped up, someone said no, so they have not seen anything. They feel pretty comfortable in deciphering through. Awesome. Well, let's move to our second question. And that one is, what are your main sources of information about the coronavirus outbreak? Again, we're on that same website, menti.com, and it's the same access code. It's just a second question, so 826756. You can select more than one answer option. I love how it's going to dance for us a little bit. Your answer options are family and friends and neighbors, and I want you to include social media here. Another option would be your local news outlets, so whether that's your newspaper or your television station or even a radio. You can think about national news outlets, so more of those major networks, your national government officials, maybe public health organizations officials that could be local in our state or beyond, and state or local elected officials. Okay, What are your thoughts and responses to what we're seeing, Natalie?
I think it's actually really interesting that I'm kind of surprised that national or government officials is as low as it is, especially during this time right now when we've seen a push of the World Health Organization and the Center for Disease Control information. But I am loving that we are having a lot of the public health organizations and officials come through to the top, as well as obviously elected officials as well. Really important. Maybe Governor Bashir's 5 o'clock, that could be where you're getting your information. So it's good stuff.
Thank you all for participating and sharing. One of my other takeaways is getting back to our slides now.
Courtney, your microphone is messing up on us. You might try refreshing it.
All right, so we'll go ahead and talk about this word, an infodemic, because like you and most Americans and everyone right now, we may be feeling a little overwhelmed, or that we need a break from the news. And actually, guidelines from the World Health Organization and the CDC do recommend that you take breaks from news and from getting information wherever that source be, whether it be from friends, family, social media, your local information, wherever you're getting your news, wherever you answered in that poll. Just take a break from it, knowing when you're feeling a bit overwhelmed or that you're taking in too much. So, in fact, the World Health Organization says that right now we are living in an infodemic. So I had never heard of this term. So I want to give you the definition of this term and see if you feel like it fits, right? An overabundance of information, some accurate, some not, that makes it hard for people to find trustworthy sources and reliable guidance when they need it. So I think that this fits perfectly with what we have discussed so far, again, in trying to figure out that fact or fiction, what's noise, what's news, what do we trust, what do we not? Like we said, from 4 years, right? That this information that Mindy shared from the beginning is still relevant. And we have so much information from social media, all different types of platforms, people sharing news. And so we want to answer some of these frequently asked questions that we get about how to sort that fact from fiction in this time where we're living with an information overload in this infodemic. So hopefully today you will learn how to find that accurate information and how to maybe dismiss some of that not so accurate information.
Right. So I think one of the first questions that come to mind is then why? We recognize that there is an information overload, but why? And there are a variety of reasons. One thing is that new or emerging issues often have a lot of unknowns, and the unknown is uncomfortable. So something like COVID-19 is still relatively new, and we have a lot to learn. And rest assured that scientists are working overtime to better understand more about this virus. Where did it come from? Why does it seem to affect others more than others? Or why does it seem to affect some more than others? Why do some seem to have more severe illness than others? And what are the best types of methods of prevention and treatment? When we have answers, we feel better. And we are wanting to try to make sense of the world around us so that we feel less uncomfortable with the unknown. And this is a perfect storm. So if we have the unknown and we start to create stories and that sound mostly true or close enough to true, then we can easily share them on social media. We might do this unintentionally. Maybe we don't know whether something is true or false, and we want to see what other people think. Or maybe we're sharing something because we want to try to protect our friends and our family members. So let's hear another question from one of our agents across the state.
Hi, I'm Jill from Todd County. My question is, what do I need to look for when trying to find news instead of just noise?
Great, thank you, Jill. So how to find health news amidst the noise. This comes from healthnews.org, which is a public health or health news watchdog from the University of Minnesota. And they offer us a lot of tips. So hang on, we have quite a bit to cover here. But these are some kind of best practice criteria of what news stories should report if they are a high quality health news story. The first point is ask yourself, does this article avoid exaggerating potential benefits, or does it ignore potential harms? We always want to know the effect of an intervention. This might be a vaccine, it might be a medication, and we want to know, we have to interpret it within where it is in the research process. So are they reporting on the benefits seen in animals? This wouldn't be super relevant to humans. Are they reporting the benefit in a single human, or is it a larger group that maybe is more similar to people like you? Stories are a really powerful way to talk about the effects or the harms of an intervention, but what is true for one person is not necessarily true for others. And that's why it's important to see some numbers. They can give us a better sense of how appropriate or applicable something might be. We also don't want news stories to ignore any potential harms, because when we make health decisions, there are risks and consequences, both positive and negative. And so learning about the frequency and the severity of some of these side effects or potential complications is important and can help us make decisions thinking about a risk, a cost benefit analysis. And this leads us to the next point, which is discussing the cost. Does the story talk about how much this drug or this vaccine or this test costs? Oftentimes we think about money, but there are other factors that could be considered. This could include resources. So does somebody need, maybe they're talking about a specific diet to treat you, and how much would it cost, or how could they access the types of foods that are being suggested by something? We also want to think about the time or the burden that this might place on the individual who wants to try this new approach. And when we're talking about new approaches, we want to think about them in comparison to already existing approaches, whether these are already existing medications, vaccines, tests, etc. And this is because the tried and true practices have a lot more evidence surrounding them. And new is not always better. And so being able to compare something that we know less about to something that we know more about can help us better understand whether it's a good fit. And then we also need to know whether it, meaning the intervention, is available to you. We are hearing exciting information about the prospects of vaccines for COVID or even treatments, but these are still in the very early phases. And so they are not open to or accessible to a wide range of people. And other treatments might be available only in certain countries, not in the United States. And the last few pieces get to the quality of the evidence. So is evidence presented? Not all research studies are created equal. Some are based on observing something that is happening right now and reporting the effects, whereas others are an intentional trial. So they're comparing one thing to another and can give us more information about cause and effect. We want to make sure that news stories avoid disease mongering. This means making a mountain out of a molehill. We do not want people to medicalize or capitalize on our fears by trying to promote or sell us that we need this test or we need this medication or treatment. We also want to make sure that news stories include comments from people independent of the product or the research results, because they are more neutral, meaning they have less bias on the topic, but can provide an informed opinion. We also want to know if there are potential conflicts of interest. So is it the sponsor of a product or a research study that's reporting? They may be more biased than someone outside of that entity. And finally, does the story show us what is truly new or different? This always makes me think of shampoo, where they label it as like new and improved. And it can't be both new and improved. It's either new or improved. And so making sure that we're not just rebranding something that we already know works or does not work.
Perfect. So to really get into some specifics about what to look for, one of the first things that we want to touch on is who said it, right? So Courtney kind of went over a list of different things, right, of what the story looks like to find health news, right, amidst all the noise that's going on right now. So some of the things that we want to help you with is, right, looking specifically at who said it. So how can we sort the fact from fiction? So if the author's name is easy to find, then that usually means that there's some facts going along. Because if it's fiction, sometimes it's hard to know who wrote it, or you can't find the author's name easily. It may not even be listed. So if the author's name is easy to find, it's most likely going to have a check mark by could be a fact, but you're going to have to do some more digging, right? So the other thing that you want to look for is the credentials, so the experience. What does the author have in terms of dealing with whatever condition or scenario that they're working with? So looking at the author's experience. If you can't find information on the author's background or their experience, then you may not want to trust it, right? If they aren't a specialist, or if they don't have a background, or if they haven't gone through certain trainings, then they may not be the person who you want to listen to for that fact or that news source. Another thing to help with the fact of who said it is the author is respected in the community and by their colleagues. So you can tell that that is a fact, right? Or fiction. So if, again, you look and you see that the authors don't have any experience, so if you go back on certain authors and certain writers from journals, you can see a list of all of their publications and their research and what they have worked on, maybe for 20, 30, 40 years. Their whole life has been dedicated to this certain focus of whatever topic you're looking at. So that's when you know that they are experienced, they are respected, and that they, again, are promoting their name, their credentials. It's easy to find, easy to look them up and to see what they have in terms of their background and their focus on that topic. Again, so that helps you know that it's a fact. If you can research, you can find all of that information about the author. If it's hard to find out who said it or who the information is coming from, then you may want to sort that into a fiction pile of it may be too good to be true, right? So it's going to be a fact if you can easily find out who said it, their background, their specialty, whatever the focus is, easy to find that. Versus fiction, it's going to be harder to find out who said it, maybe little or any information on their background or really the experience that they have about the topic that they're sharing.
Thanks, Natalie. Can you hear me better now?
Yes.
Okay, so I'm so sorry, everyone. It's not a good day for internet or cellular data here. So Natalie told us a lot about who to look for and their credentials. And so we also want to think about where did the facts come from? And this plays along with the who piece in that we want to think about the organizations that are sharing information or the individuals, what their affiliations, where their affiliations lie. And we also want to think about whether sources are listed. This would be one of the biggest concerns, is that if there were no sources listed, we can write all the information in the world, but if we can't link it back to an original source that can support the statements or the claims that one is making, then we really want to be concerned about whether or not we should trust it. So if sources are listed, that gives a positive check mark to think about whether or not you should trust it, but you still want to proceed with caution. It's always great to check out those links and make sure that they're actually reliable. When you want to be really concerned about fiction and where facts come from is if you can't tell where the information comes from. And I actually have a really great example of this. I've been working with some interns on a project unrelated to this, but they were sharing information and websites that could potentially be of use to the public. And upon further review, the website looked great and the information seemed relatively reliable. However, it was unclear who wrote it. It was unclear the stature of the organization that was sharing this information, and there were no links to original resources with this dietary information. And therefore, to me, that was a red flag and a concern that, while there might be some value or merit to the information that's shared, we probably don't want to be sharing this with others. And I would include that in the fiction category. So think about the organizations, what they stand for. Is it appropriate that they're sharing this type of information? Just because one organization specializes in heart health, for example, doesn't mean that they're going to be the best source of information for allergy information. And then looking at, to Natalie's points, who those individuals are and whether they've cited individuals who are credible and have experience.
Perfect. So another thing to look for aren't clearly related to the content, or they appear to be selling something, right? Or they're trying to, maybe they have certain interests in it being a negative study so that way you buy more of their product, right? So looking at really where the funding for the research is coming from, or who is sponsoring it, or who is promoting it with financial interests. It's a fact. You can see if information does not try to sell you a product or sell a point of view. So again, thinking about social media, particularly, a lot of people are trying, again, that fiction to fund or to sell or to try to get you to buy something. So again, looking at that information, because if it's quality information, they aren't going to try to make a profit off of you. They aren't going to try to sell you something. They are trying to get that fact, that health information out to you. So looking for that fact for fiction, trying to figure out who paid for it. Again, sources should be listed, sources should be trusted, and then figuring out if the information is quality by they aren't appearing to sell you something. And so all of those things should be clear and in the public. If you can't see where the funding came from or who the sponsor is, then it's probably a little tricky to trust that information.
Natalie, the word transparency comes to mind with a lot of the points that we're talking about. In that really you just want to ensure that whoever's reporting or sharing information is transparent about where everything's coming from.
Exactly.
I'm always thinking of the kids with the memes, like the skeptical looking kids. And so that's what we want to instill in you all today, is to really just kind of be a skeptic. And so another question we want you to ask yourself or ask of the article that you're reading is, when did they say it? It's more likely to be fact if the information is current. Science is a process. If you haven't heard that before, I'm here to tell you that things are changing, sometimes at a snail's pace, but right now, particularly with COVID, they are changing more rapidly. And so if you're looking at information that is old, and how old is defined could really depend on the topic that you're interested in. So if it's COVID related, old might be 2 weeks ago, it might be a month ago, it might even be this morning by the time you get to the news at night. But so just making sure that information is current, that will make it safer to trust. When you really want to be cautious if something could be fiction, is that if information maybe seems out of date, and this could be based on the date at the bottom of a web page, for example. Maybe it was last updated in 2018. Things have probably changed by now, and so you always want to make sure you can incorporate new information with pre-existing. It's not to say that new information always cancels out old. It just really, I like to think of all of this as a puzzle. And all the new pieces of information we get added into that puzzle to create a bigger picture. And so if you're reading something that was true at one time, but is no longer up to date, it could now be false. And so always look for those dates of information. And if it's not there, be a little skeptical as to whether or not it's something you should trust.
Perfect. So moving on with looking at that information that you can trust is figuring out, right, when looking at the science, how did they know? So medical information, again, right, is based on research and studies of a lot of different people. So if you're finding a study or a news article where the information is based only on someone's opinion or on individual experience, then it may be true for them, but it may not be true for everyone. And it may be fiction in terms of just their opinion, right? So not a fact, just an opinion and a thought. And so that's fine, but take it with a grain of salt, right? Looking for that information that is research-based is where you're going to find those news facts. Another thing of how did they know, right, is that science and quality news information matches what you found in other sources. So you're able to kind of fact check by going through and finding other news articles or other resources, other sources, other research that has been done that has come up with the same answer or a similar answer. That is quality information. If it maybe there's no sources that match up to that same information, it seems too good to be true, most likely it is too good to be true, right? And so it's, again, based on an opinion, on an individual experience, and it's not based on that quality research, quality information. It's just something out there. So again, if it seems out of the norm, if you're like, well, I've read 6 news articles that says this, but one says this, I'm going to listen to that one. You may not want to do that because there may be some fiction and some reasons not to trust that over the others.
All right, let's hear our next question.
I'm Latoya Drake, the Barron County Agent for Family and Consumer Sciences in Glasgow, my hometown. And what are some red flags that you should be aware of?
Thank you, Latoya. Red flags is one of my favorite topics. And Natalie and I have covered a lot of information thus far, but we can think of these red flags as like the quick and dirty points to look for when you're doing a fast assessment on a new piece of information. Headlines are headlines for a reason. If you had a chance to listen to the podcast before we got started, Mindy and Jennifer were talking about this. Sometimes the titles have nothing to do with the information, and it's essentially clickbait to get you there. But we realize titles need to be interesting, otherwise people won't read them. But so say a headline has caught your attention and you click on it, the first red flag would be if you can't figure out where the story came from. There's no author, there's no publisher, there's no affiliation, let it go. If you read the article and the main purpose is to sell you something, and this may not be so obvious, you might get through the first part and it seems to give truthful enough information that it's believable. But then you kind of get deeper, and all of a sudden they spin and try to link you to a specific product or treatment that should be used. Let the news piece, let the information go. If they claim of a secret cure or miraculous result, it probably is too good to be true. So just stop right there and let it go. And then if there's no mention or link to evidence, we've been harping on this. And it's not that everyone needs to become an expert in research methodology. That's what we are here for. And we can support local extension offices as well. But you just need that transparency. Are they being open and honest about where their information's coming from? If not, let it go. And finally, if there's poor grammar and misspelled words, just stop right there and don't waste your time, because it's probably not anyone who is very informed on that topic. And so my stop sign to you, as Natalie said, if it sounds too good to be true, it probably is.
How can I spot good information on the internet?
Perfect. So that is a really common question, right? Especially right now with people trying to go through their own information and figure out what is important and what to see when they're Google searching, when they're figuring out, trying to do their own research, or maybe trying to figure out what to trust and what not to trust. So again, do your own research, that's great, but we want to help you figure out how to spot good websites that, again, are quality and research-based, that are going to share the correct information. So again, websites, like I'm sure you guys know, cost money to create and update. The source of funding, again, should be clear, should it not be clear? So we want to help you figure out who's funding these websites that you may be getting your information from, in terms of figuring out if the website is going to be helpful or if it's not. So this is from the website address, the URL. So you want to maybe think about fiction. So that red light, that stop sign, that I'm going to think before I go, or at least look around before I go, is the .com. So these are commercial websites, such as businesses, pharmaceutical companies, places that may be trying to sell you something, again, right? So they're commercial. So they are maybe not as factual as you want. Again, the .net, .info, .biz, those are all general usage businesses and networks that may not be sharing the most evidence-based research and facts. Again, they are trying to run and fund a website, and so they could be trying to sell you something, or just someone who is just getting their own opinions out there, which again is fine, but just think twice before you believe everything you read from those websites. So the top three that I would say to go for are going to be your .org, your .edu, and your .gov. So these you can still proceed with caution, the yellow light and the green light, but looking at these websites are going to be more beneficial for finding news instead of noise. And so .org is identifying a nonprofit organization, such as professional groups, even scientific and medical research groups, and research societies or advocacy groups. So .org nonprofits are usually really evidence-based and quality websites to go to. .edu is going to identify an educational institution like the University of Kentucky, a college, a school, again, somewhere that is going to make sure that they have scientific, evidence-based research information going out to the public. And then again, .gov is that government agencies. It identifies the website as a USA government agency that you can use. Again, trusted information is going to be spread from that as well. So we want to share really about websites because I know, for example, you can go on the deep dive, right? Really easy to go on a crazy Google hunt, Google search for information and it's easy to get lost really quick. But I will say, if you can find that .org, .edu, .gov website, so it's at the end of the web address, those are going to be the most helpful, where you know you're getting the best quality information. So sometimes, depending on the topic, it can be really hard to find websites that are giving you the correct information, but I really would emphasize trying to find those web addresses to get your information instead of a .com.
Great. I think we've got another question similar to that.
My name is Kelly Burgess, and I am the Family Consumer Sciences Agent in Allen County. And I was just wondering, with so much information out there, especially about COVID-19, where do we go to make sure that we're getting the most trusted and most reliable information?
Thanks, Kelly. It's another important question. So Natalie talked generally about websites. When we start to think a little bit more specifically to COVID, there are a variety of local, state, and national resources for information. Your local hospital or public health department can be an important source of information, and they can really kind of give you a better picture of what's going on in your neighborhood, what's going on in your neck of the woods. Your doctor's office or community health center is another important source. And the local cooperative extension offices are a wealth of information for COVID and beyond. Each of these entities might have brochures or handouts or things of that nature. So you might be able to access some hard copy information or even just a person to chat with. We also have our state public health departments that are really leading the way with efforts within each state. And then to Natalie's point, you can look for some of those reliable health information websites like .edu, .gov, and .org.
And so a lot of times people aren't sure, like we mentioned earlier, like looking at the date, looking for the most up-to-date information on coronavirus for trusted resources. And it's moving right a mile a minute. Things are changing. And so it's important to have those go-to resources that's trusted for your evidence-based information. And so 2 resources that I wanted to really share with you to include is the World Health Organization and the U.S. Center for Disease Control and Prevention. So their sites are going to offer a key information about COVID-19, whether it's including how to keep your family and community safe, or even how to avoid coronavirus myths. So these are really good websites to go to. They're going to have the most up-to-date information. They clearly have their authors, their date, and their facts listed. So easy to read. And I would really encourage, if you see something on another website or on another news that states something, going and checking on the CDC or the World Health Organization's websites to maybe make sure that that was a factual statement that was being made.
Some of our Kentucky-specific resources that we want you to encourage to check out or bookmark include the Kentucky COVID-19 website, which is kycovid19.ky.gov, and they are up to date with the latest and greatest of what is going on here. We have a tiny human Zoom bombing back here, sorry. We also have a COVID-19 hotline that can be used. These are staffed by healthcare professionals and poison control experts, and they are there to answer your questions and link you to resources, and then your doctor as well. And then our final question.
Hi, my name's Jennifer, and I'm from Brandenburg, Kentucky. And I have a question. How can I know for sure that the health information that I'm reading can be trusted?
Perfect. So this is kind of the quick checklist to make sure that the health information that you're reading can be trusted. So kind of going over everything that we have said before. If you want to click, I have this on the animated Courtney, so it will come on in. Perfect. So the one right to look at is the sponsor or owner of the website, again, like the federal agency, a school, or a large profession nonprofit organization. So the .gov, .edu, .org, those sites are the ones where you can go to get that quality information. Like we just mentioned, the Kentucky coronavirus website has that .gov, so we know that it's trusted. So if it's related to one of those, you can trust it. If it's not, if the website is written maybe by another healthcare professional or it doesn't have a reference, then maybe it's not a trusted news source. Another one to look at, right, is can you see who works for the agency or organization and who authored the information? So again, looking at the author is really important for that fact or fiction. It should be really easy to spot. And then the next one is, when was the information written or was the web page last updated? So for articles, usually the date is posted at the top, right? And so news articles have the date posted at the top, or newspapers, magazines, different things like that will have the date on it. For websites, the web page, if you scroll all the way down to the bottom, like the CDC, for example, they are going to have it last updated and then given the date, and that will be at the bottom of the web page when you scroll to the very bottom. So that's where you can find the dates, either on written or web pages, really important. And then the next one is making sure when you're on the internet for sure is that your privacy is protected. So you shouldn't have to put in any information to get quality information, to get that real information. So again, keeping that in mind, as well as knowing that they shouldn't be trying to sell you something or to get you to join a news list or anything like that. Your information should be private, and you should not be trying to buy something if it's quality information. And then the last thing, right, that we've hit on a few times now, that red flag is, does the website offer unbelievable solutions to your health problem? Is it a quick fix? Is it something that you're like, no way? Then it probably is no way that that can happen. So keeping in mind, if it sounds too good to be true, if it sounds too easy, if it sounds like a quick fix, then it probably is something to maybe look a little bit more into, or to just let it go.
All right, thanks, Natalie. So just to tidy everything up, I think she did a great job. We've taken a lot of information and tried to funnel it down for you into just a few checklists of red flags or things to look for. And so to hit on today's takeaways, that we have offered a lot of ways that you can sort the fact from the fiction. We want you to remember that we're still learning a lot about the virus. Our medical teams, our scientists, our researchers are really working hard to learn about the virus and learn what we can do to learn what we can do to better prevent and treat it. And so information will change. And so to keep that in mind, to make sure you're seeking up-to-date information from those trusted resources, your public health officials, your local universities and colleges, the .gov, that .edu website, your local medical professionals. Be skeptical. It's okay to question news that is shared with you. And that doesn't make you mean. It doesn't make you a bad person. It just, you can help stop the spread of misinformation by pausing to go through some of these checklists. And then that leads to our next point, is to think before you share. Again, it's super easy to share. We don't even have to really read through it. We might share it based on a headline. So again, pause, give yourself that moment to read it and determine whether or not it's fact or fiction and whether it's something you should share. And if you're unsure, reach out for help or questions. Again, we are here. Your local extension agents are a wealth of information, and they can help you determine whether or not to trust something. And finally, to Natalie's point back at the beginning, is to take a break from the news. It will be there when you return, and you'll always be the most up to date. So turn it off, maybe limit the number of times you look at things, or limit the number of sources that you seek.
So we hope that this helped you kind of figure out the best ways to sort fact and fiction. And I love what Courtney said, just to take a moment and pause when you see a headlines before you share, and that it is okay to ask questions and to be a skeptic about certain things. And it's okay to have discussions with people if it helps you better understand where the information is coming from, or to make sure that it's true. And I think that that's really important. And so we are going to stay on for a little bit if there are specific questions or any comments, but I hope you have learned maybe where to get the best information, or when you should look for more information, or really what questions to ask and where to find out if it's fact or fiction. So thank you for joining us, and we'll stay on for questions for a little bit.
I certainly want to thank Natalie and Courtney for sharing this great information. I do think that we have the tendency to have more information than maybe we know what to do with. And I want to take maybe just a step further from what they said as far as researching your information. If you find out that information is not factual or inaccurate, go back to that person who shared it originally, send them an email or give them a phone call and say, hey, listen, I saw this on your page. And you know, I've done the research and I've checked it out and it's not true. You might want to take it down. I'm not asking you to of course, start a social media war on that, but I do think it is good to let people know that that information that they are sharing is inaccurate if you found that out as well.
Thanks for bringing that up, Mindy. I do think that's a good point, and a lot of what I've been reading, I might follow what you say is nerd Twitter, in that I follow people who talk about health communication and science and research, and this has been a hot topic about how to talk with people when you identify that they are sharing something that is not necessarily true, and it can be kind of a delicate dance, if you will, to try to do that. So I think it's to elaborate on your points is to be kind, to be curious, to kind of acknowledge that, yes, we're living in kind of a crazy, wild time that might be scary. Say, I see that you've shared this. It's different from what I've been reading. And if it's okay with you, could I share some of the things I've been reading? And maybe we could talk about this. And we may not change everyone's minds. But to Mindy's point, I think it's really important to point out misinformation when we see it.
Mindy, we do have a question about where they can go back and re-listen to this if they want to refresh memory or if they got interrupted.
Certainly. This will be on our Facebook page as a recorded version of the live production. And then also you can find it on our YouTube channel, which you can find very easily by typing bit.ly/FACS, all capitalized, _ learning with the L capitalized and _ channel. Underscore and then channel with the C capitalized. And I've typed that in the comment box, and I will also share that on Facebook Live. And so that is where you'll find our YouTube channel, and all of our presentations are available there.
So we actually just had a question on Facebook that says, what about doctors on TV who are promoted as authorities, but who give suggestions that are contrary to what we have learned? So that is a great question. And thinking about the author is, again, or who's saying it, right, is really important. And unfortunately, there are some people who use maybe their medical license, I'm a doctor, so I can say this, to still share maybe their opinions. And so I think that it's just, again, important, even if they are a famous MD or a famous nurse or a famous professor, is that it's still important to always look for more information, right? To kind of fact check that. And again, like Courtney and Mindy have said, there's nothing wrong with that. There's nothing wrong with being skeptic. And so again, if it sounds contrary to maybe some things that you have heard or research that you have seen, check it. And then if you have specific questions, go to your own healthcare provider. maybe if it's regarding a certain health topic that you're dealing with, or you have a family or spouse dealing with it. I think that it's fine to dive in to ask more questions to see if that is accurate. Maybe it's a new and upcoming research, and so it could be factual, but it may not be trusted or evidence-based quite yet. So just keep it in mind, even if it does seem like a reputable source, like an MD or a professor or someone saying something, a researcher, it's okay to still check whoever is saying it.
And always remember that your celebrity doctors are actually selling television time. And so they want you to watch their show. And so they are going to share things that are going to bring in viewers, and it might not necessarily be factual.
Great question though. Yep. Just always stay curious. That's what I say. Just always be curious. Look it up, do your own deep dive.
In this case, curiosity will not kill the cat.
Very true. Very true.
Not really a question, just a comment about that it was important to pay attention to articles, because many times people will post things that are very old information. And I think that's worth repeating.
So true. Yes. Yeah. And I think that that's also hard because, especially with certain research, things change really quick, like coronavirus right now, right? New information is coming out as we're learning more. And so making sure that we're checking the dates on things to see if it's the most accurate. It's important.
And just to tag on to that a little bit is that in this day and age with technology and how easy it is to make graphics and things that look nice, it might make it a little bit tougher at face value to see whether something is trustworthy or not. It might look slick. I'm thinking of, there's a lot of documentaries out there, some better than others. And so they're crafted really well and they're interesting, but they don't necessarily have the evidence base behind them. And so to the person who commented that, yes, what's old is new again sometimes. So checking those dates and trying not to get too hung up on whether something looks nice, because even those more fictitious things that have an agenda they look really good.
And I think that's a great point, Courtney, also to bring up, just like Mindy said, with TV shows and different people that you may see as guests on news or different things, is that documentaries are movies. And so they are trying to, maybe they are trying to get more people to watch it or to get an interest, as well as they obviously are maybe one-sided and have their own bias towards the information that they're sharing. Not saying it's not good information or quality information, but again, maybe you watch a documentary, you may have a few questions like, I have never heard about this study before. So maybe you go look it up, ask your healthcare provider about those specific questions that you have. And again, sometimes they're telling stories about certain people, so it may work for them, but it may not be true for an entire population, for people. It may not have been done in a research setting for multiple studies. So again, keeping everything in mind, and that it can be hard. This, I feel like, is a daunting task of finding fact versus fiction. There's a lot that's involved with it, but just being patient and kind, like Courtney said, there's no need to be rude or to really lash out about information, but just making sure that you are educated, and when possible, sharing education with others, whether it be even this webinar of maybe you realize someone in your family or in your close acquaintances keeps sharing misinformation. And so maybe you're like, hey, I listened to this recording today from the extension office, and I think that you would find it interesting, and you leave it at that, right? So just keeping that in mind as well.
I do think that your point that information changes is very important. And as an example, we can talk about the cloth face coverings. When the CDC first came out with recommendations, they suggested putting a filter, a coffee filter in between the cloth. to use while you were wearing the face covering. And then after a couple of weeks, they realized that wasn't the best advice. And so they did change that. And of course, we took their information and we shared that information to begin with. And then we changed our position as well once we realized that the recommendations from the CDC had changed.
Great point, Mindy, that things are changing. I can think of so many examples. Of the grocery, wiping down your groceries was one that came to mind, because early on it was recommended that we wipe down our groceries before or right after we bring them into our homes to prevent the risk of transmission. And now, as we've been able to gather more evidence, we're learning that that's not necessarily the highest risk or most likely way to transmit the virus. And so just trying to, again, be patient, cautious. The goal here is to protect the public's health, hence why they are leaning towards those more conservative recommendations. And then as we begin to learn and continue to learn more, we can update and revise accordingly.
And we also don't want people to think that because someone is changing their information that they were being malicious or had a bad intent to begin with. It's just that the science has advanced, within this time period, and so they are sharing that information. And so I would find them probably more reliable than somebody who has a position to begin with and sticks with it and doesn't change their position based on what the new science says. All right, I think that we have answered all of those questions that people might have for us. As always, if you are watching this on record and have additional questions, you can feel free to reach out to us on ukfcsext@uky.edu, and we will get the questions to the appropriate specialist so that you can get an answer to your question. If you want to post on Facebook Live, or on the post on Facebook Live that you have this question, we will also make sure that our specialists see that and can respond there as well. So thank you for joining us. We will be back again next Thursday with a relationship conflict. So we hope that you will join us then at 11 o'clock as well. Central Time, 10 o'clock Eastern. 11 o'clock Central Time, 10 o'clock Eastern Time. I said that wrong again. One more time. 10 o'clock Central Time, 11 o'clock Eastern Time. I will get through this. Thank you all. Have a great day.